PANDIAREMIC 84. Dystopian Hospital 2084. Fever, headache, sore throat, pain in my bones which feel like someone is stabbing my whole body. I can hardly breathe. When I breathe, I feel like someone is suffocating me with a plastic bag over my head, said the patient. First, the doctor thought it might be an ordinary flu. The doctor prescribed him regular medicines and wrote him a sick leave to rest at home for a couple of days. A few days passed. The patient's wife came to the hospital with the exact same symptoms as his husband had in the previous days. In those days, there were rumors about the new virus called COVID-84. The virus was detected in the USA. Actually, the new virus is so familiar with the COVID-19. COVID-19 was also a pandemic for more than 2 years in the world. The doctor was scared that new rumors would become true and there will be a new pandemic called COVID-84. The doctor was not comfortable with the feeling that a new pandemic might be on the brink of the world. So he decided to go to the hospital's library and borrow a vintage book. The contents of the book were about COVID-19 pandemic days, thus he would have a chance to compare the cases. The librarian woman was surprised because no one for more than 3 decades wanted to read that book. The book was called COVID-19 Pandemic Diaries. The front page of the book was all black, which represents the mourning of thousands of casualties due to the pandemic. That pandemic was on the blacklist of the earth. Some governments banned all books and media to talk about the pandemic. The doctor has decided to read the book at his home and try to understand what had happened during the pandemic. As he came back to his home, he lied on his couch and opened the first page of the book. The doctor started to read aloud. Day 1. A doctor in early 2020. The virus has finally arrived in our country. Today we had the first case of coronavirus. It means I will work facing that every day. The country will experience something called quarantine. Unfortunately, coronavirus was announced as a pandemic by World Health Organization pretty late, and it is all over the world now. I have to come to the hospital and take care of my patients, which means I am at the high risk of contracting the virus. I am afraid of my children at home. I don't want to transmit them the disease. The government promised us to provide a temporary home for us. Day 5. An ordinary citizen. COVID-19 is all over my head. I don't believe in this virus. This might be the play of big powers. When my wife comes home, she suddenly stays at the front door and takes all her jacket, mask and gloves and runs to the bathroom to wash her hands for a minute. She cleans the stuff that she bought if they were in a mud. Day 45. Ordinary citizen. I cannot go to the work or earn money as my employer cannot pay my salary for the last month. We cannot even afford our basic needs. Due to the quarantine measures, we have to be stuck in the same house with my wife. I think we are getting a divorce. Day 1. Student. At first, we were making jokes about the coronavirus. Funny guys in the classroom were pretending to cough or sneeze. After the first case, our schools were closed within 2 days. I am so glad that the exams are postponed, so I will be able to rest at home all day. Day 55. Student. The situation has not progressed as I have imagined. The schools have started distance learning, which is unproductive and painful. On day 20, the government banned us from going outside. I felt trapped like a mouse. Yesterday, they made an announcement saying that we are allowed to go outside between 1 p.m. to 4 p.m. Day 50. Restaurant owner. I am head over heels in debt. It has been more than a month since we have taken down shutters. I couldn't pay the salaries of my employees. I couldn't pay my rent pay for the last month. No home to live, no restaurant to work, no food to take home to my children. Day 70. Old lady. In my 75 years of my life, I have never felt that much alone. My son cannot visit me. It has been 2 months since I haven't seen him. My neighbors buy my groceries because I am not allowed to go outside at all. I really wanted to see sunshine again. I feel like this quarantine will continue forever. Mask, disinfection, social distancing. The doctor closed the book gently and desperately. All the people who wrote in the diary appeared in front of his eyes. All the stressful problems that people had encouraged during the 90s, the lockdown, the economy, the fear of that was the reason why people didn't want to remember back those days. The doctor had made a good choice by reading that book, as he learned how the pandemic began and how the consequences were. He knew the solution. He made a phone call to WHO and asked them to announce a potential pandemic. He informed the government to initiate a law force people to wear masks, keep social distance, and take care of personal hygiene. COVID-84 has never become a pandemic thanks to early measures that were taken.